A man in Mexico recently died from bird flu, and this may be a cause for concern considering the strain of the virus has never been found in humans.
Joining us now live here in studio is Dr. Chaffoo. He's here to talk more about if the virus if we should be concerned following that latest death. Thanks so much for being with us today.
Of course. So I think it's always concerning, of course, when we read something like that in the paper. It was interesting. The unfortunate person had, multiple other medical problems, had been exposed or was exposed to birds probably that were infected with this virus, and was hospitalized for a relatively long, protracted period, and then unfortunately passed away. So, but that does bring up the issue of this virus. Right now, fortunately, there is no human-to-human transmission, which is, of course, how we had this pandemic that occurred not that long ago. It's primarily a virus that was thought to originate in China back in the 90s with geese, and then gradually it was then found in Europe and then made its way to North America, to Canada, and to the United States.
So what do we know about how this person in Mexico contracted it? Was it through contact with a bird? We know that some cows have had it. Like how
Sure, so they're not sure. I think they're still tracing going backward. I've also heard reports that it may have been due to poultry, because there is the concern now that they found the virus not just in birds but in other animals, one group being cows, so dairy products. Fortunately, the FDA looks frequently at the milk products, and what's interesting is they found some of the viral particles in milk, but not the live virus, because milk is pasteurized, and so that's a way that we're protecting.
Could it be something you get from eating chicken?
It could be. It could be from chicken as well. They're finding evidence that it will present itself in poultry. So of course you want to really be careful about eating the poultry and making sure that it's been prepared and heated properly. Most experts say you want to heat poultry to at least 165 degrees Fahrenheit. So you want to get that meat thermometer, make sure it's reached that magic number that's going to kill off all kinds of viruses, including the avian virus.
Is anyone at risk for getting this, or does it seemingly only impact a certain group of people?
So Zara, it can affect people that tend to be around a lot of wild aviary, wild birds, people that work in farm environments. Certainly, if there are any animals that are ill, people that are around them frequently, from the saliva, the feces, the raw meats, are potentially at risk of getting contacted. It's not very common. There are a few isolated cases in Southeast Asia as well, but it's something the FDA is watching and the CDC are watching very carefully.
Seems like there's a lot of question marks around it. Is this strain different than ones we've seen before?
It's different, Andrew, in the sense that it's a slightly different strain. But what's important is that there are so many different strains out there. The influenza virus being one, and the important thing I think for the public to understand is that these viruses have an amazing ability to mutate and go from one species to the other. So this is something that they're watching very carefully, the CDC, because once it's able to mutate in other mammal species, the concern is that we'll then jump to the human species. Right. So that's why there was very concern in that report in Mexico of that person that passed away from it.
And how does someone even get tested for the bird flu? Is it like a COVID test
or something?
Unfortunately,
Zara, there's no testing right now that's where, again, high index of suspicion if you're ill. One of the hallmarks is conjunctivitis or redness of the eye, but the other symptoms are ubiquitous. We'll find, fevers, chills, coughs, a sore throat, headaches. Those are sort of general symptoms of the flu. So if you're concerned, obviously you want to get in to see your health care provider to get evaluated. Certainly, the extremes of age, the very young children, people that are older, or like this unfortunate person in Mexico, had multiple other medical problems. When you first start to get symptoms, that's the time to get in and get evaluated.
And again, with all the question marks of like, okay, if you're near birds or you eat chicken or you're near cows, you drink milk, whatever, we just don't quite know exactly what's going on here, which is not a great place to be as far as being uninformed. Are there precautions we can take, reasonable precautions?
Sure, there are. So obviously, drink pasteurized milk. Make sure, like we said, we cooked our meat to 165. And then if you're going to be around these animals, or you have to be in terms of your job, wash your hands with warm soap and water. Make sure you're wearing a protective mask, goggles, because it can get in through the eyes. The conjunctivitis is seen. And then obviously making sure that if you have any symptoms whatsoever, you want to get in and get evaluated very early on.
And can you be treated for this, and how does that work?
So right now, Zara, treatment is just kind of supported medical therapy. There is no real specific antiviral, neither a vaccine nor specific drug. There are viral agents that your physician might place you on, Tamiflu being one, and there are multiple others, but more specific in terms of what the symptoms are like and how severe they are.
All right, Dr. Richard Chaffoo, we appreciate the insight.
Sure.
It's a subject that we've been talking about quite a bit, but now that we have a human case that has turned deadly, it's really important to at least understand it as best we can.
Definitely.
All right, thanks so much.
Sure.
Thanks for being with us today.